Breastfeeding is a natural and beautiful way to nourish your baby, but it can also come with its fair share of challenges. Many new mothers find themselves struggling with various issues when it comes to breastfeeding, but with the right information and support, these challenges can often be overcome. In this monologue, we will explore some of the most common breastfeeding challenges and discuss potential solutions. One of the most common challenges that new mothers face when it comes to breastfeeding is difficulty with latching. Proper latching is essential for successful breastfeeding, as it ensures that your baby is able to effectively extract milk from your breast. If your baby is having trouble latching, it can lead to frustration for both you and your little one. There are several potential reasons why your baby may be struggling to latch. It could be due to positioning issues, tongue tie, or even something as simple as a shallow latch. If you are experiencing difficulty with latching, it is important to seek help from a lactation consultant or other breastfeeding support professional. They can help you identify the root cause of the issue and provide you with guidance on how to improve your baby's latch. Another common breastfeeding challenge is low milk supply. Many new mothers worry that they are not producing enough milk to adequately nourish their baby. While low milk supply can be a legitimate concern, it is important to remember that it is often a temporary issue that can be addressed with the right support. There are several potential reasons why you may be experiencing low milk supply. It could be due to not breastfeeding frequently enough, poor latch, or even stress. To increase your milk supply, it is important to breastfeed or pump frequently. Ensure that your baby is latching properly and take steps to reduce stress in your life. Engorgement is another common breastfeeding challenge that many new mothers face. Engorgement occurs when your breasts become overly full of milk, leading to discomfort and potential issues with latching. Engorgement can be painful and frustrating, but there are steps you can take to alleviate the symptoms. To relieve engorgement, it is important to breastfeed or pump frequently to empty your breasts. You can also apply warm compresses or take a warm shower to help stimulate milk flow. If you are experiencing severe engorgement, you may also consider using a breast pump to help relieve the pressure. Mastitis is a more serious breastfeeding challenge that can occur when a milk duct becomes blocked and infected. Mastitis can cause symptoms such as fever, chills, and breast pain, and it requires prompt medical attention. If you suspect that you may have mastitis, it is important to contact your healthcare provider right away. To help prevent mastitis, it is important to ensure that your breasts are properly drained during breastfeeding or pumping. You can also take steps to reduce your risk of infection by practicing good hygiene and avoiding tight-fitting clothing that can restrict milk flow. Thrush is another common breastfeeding challenge that can occur when a yeast infection develops in your baby's mouth or on your nipples. Thrush can cause symptoms such as nipple pain, itching, and redness, and it can be passed back and forth between you and your baby. If you suspect that you may have thrush, it is important to contact your healthcare provider for treatment. Thrush can often be treated with antifungal medications, but it is important to follow your healthcare provider's recommendations to ensure that the infection is fully cleared. One final common breastfeeding challenge that many new mothers face is nipple pain and soreness. Nipple pain can be caused by a variety of factors, including poor latch, engorgement, or even thrush. Nipple pain can be a significant barrier to successful breastfeeding, but there are steps you can take to alleviate the discomfort. To help reduce nipple pain, it is important to ensure that your baby is latching properly and that your breasts are adequately drained during breastfeeding. You can also apply lanolin cream or other soothing ointments to your nipples to help alleviate soreness. If you are experiencing severe nipple pain, it is important to seek help from a lactation consultant or other breastfeeding support professional. In conclusion, breastfeeding can be a wonderful and rewarding experience, but it can also come with its fair share of challenges. If you are struggling with breastfeeding, it is important to seek help and support from a lactation consultant or other breastfeeding professional. With the right information and guidance, many breastfeeding challenges can be overcome, allowing you to enjoy a successful and fulfilling breastfeeding journey with your baby.